Support Don't Punish is a global campaign that began in 2012. It's the community reclaiming the 26th of June, which the UNODC has named the International Day Against Drug Abuse and Illicit Trafficking, and it's marred by the extrajudicial killings of people who use drugs. Support Don't Punish. The message is concise, but vulnerable to misinterpretation. What does it mean to support? In Australia, according to our best data, 8.5 million people have used an illicit drug in their lifetime, and 15% have done so in the past 12 months. 8.5 million Australians don't deserve to be punished by being criminalised, nor do they deserve to be subjected to unnecessary health interventions. We must be clear, to show support does not mean to overtake, to assert that doctor knows best, to pathologise all drug use. For the small percentage of people who do use drugs and do need a health intervention, we support them by advocating for treatment options to be made available and for such interventions to be delivered without stigmatisation. Support Don't Punish is a refreshed core cry, echoing the self-empowerment movement that emerged in the 1980s. A movement from which we're grateful for the Denver principles by the community collective People with AIDS. While being open about their positive status, PWA refused to be non-consensually labelled victims or patients, subjected to a social death. They stood up and asserted, "Nothing about us without us." This message was reaffirmed in 1986 with the Ottawa Charter of Health Promotion. What is health promotion? It has caused some semantic confusion, and some argue it essentially means public health. At its essence, health promotion comes from a place of understanding that health exists in a social context. If you want an expanded understanding of what it means to say support, don't punish, look to the map offered by health promotion. The core support strategies that health promotion offers are enable, mediate, advocate. Many of us here do health promotion work. In my role with Harm Reduction Victoria, I coordinate the Dancewize program, which delivers health promotion and harm reduction education and support outreach services at music events and festivals. Our back of house, where Dancewize team members provide support for intoxicated people, is non-judgmental, comes from a place of lived experience, and relieves the pressure from on-site health providers, and in doing so, reduces the potential burden on public health, among other examples causally linked to social burden. Through this service, Dancewize crew may have the opportunity to provide an education intervention or referral, but this depends on the residual capacity of the intoxicated person. It's a service we're honoured and humbled to provide to our peers, but this is an example of the ambulance being at the bottom of the cliff. Compare this to Dancewize front of house, where we do educational brief interventions with partygoers that might be stopping by to grab sunscreen or other free health supplies. This contact allows for an exchange with more receptive peers, but under this prohibitionist regime, this is still an example of the ambulance being at the bottom of the cliff. But running with this analogy, maybe it's a cliff with a less treacherous overhang. Dancewize was also represented on Harm Reduction Australia's Safety Testing Advisory Service at Festivals and Events Consortium, or the Stay Safe Consortium. During April's pilot in Canberra, 2 of the 83 samples were found to be toxic and potentially fatal. While the nature of this harm reduction intervention is neatly packaged, pill testing as a one-off at a festival met with a minority of vehement and overtly moralised opposition is still too ad hoc to properly demonstrate the full health benefits such innovations can provide. In order to support people who use drugs in a meaningful way, we must roll out evidence-based health promotion and harm reduction strategies to scale, and the people whose lives are affected most must be leaders in the movement at every level. There's at least 8.5 million people in Australia who fit this bill, but fear of punishment keeps many silent. We're fortunate here in Victoria because we have the opportunity to enable, to mediate, and advocate for a philosophical and systemic shift in our drug policies, guided by the Comprehensive Drug Policy Reform Parliamentary Inquiry Report. A report made not with just bipartisan, but multi-party support, and one that makes it clear. Drug use is a health issue, not a criminal one. And remember what we know from health promotion, is health must be understood in a social context, not simply as a matter of biology or psychology. How do we do this? Yes, the parliamentary report offers a stem and leaf guide, and appointing an independent advisory council is a good starting point. I would like to offer a more simple first step. It's more like correcting an error or an anomaly. Victoria is one of only 2 jurisdictions in Australia where use, that is admitting to having ever used a drug, is a standalone offence. We're not talking about being intoxicated in public or in possession of any kind of contraband, but merely admitting use retrospectively. This is a crime in Victoria. If we repealed Section 75 of the Drugs, Poisons and Controlled Substances Act 1981, drug use would not be normalised or glorified, but the social climate would have the opportunity to shift, a safe space would be enabled so people would be empowered to speak up earlier and seek support. Let me stress the practical application of Section 75 is close to redundant. Here we have Victoria Police's stats from the past decade. You'll see people are really charged with this summary offence of use, and it's at a declining rate. Well, you might not quite be able to see it, but I'll read some of the figures out for you. In 2017, just over 2,000 use charges were laid in total, mostly as add-on offences connected with other conduct, and only 197 people were charged with use as a single offence. Those 197 people were likely to attend a treatment service, consuming resources better suited to those who are actually contemplating rehabilitation and want that support. But if a health intervention is forcibly imposed by the criminal justice system, it's less likely to be effective, even if it was ever necessary at all. And what about the disproportionate amount of harm that is done by becoming unnecessarily entangled in the criminal justice system? For the Victorians who recognise that health is promoted or demoted in its social context, who recognise that empowered communities with lived experience are well placed to enable, to mediate, and advocate for health promotion outcomes. If you agree with me in saying support, don't punish, then join me in urging our political leaders to repeal Section 75 immediately, so people who use drugs can have their identity and social standing restored once more and simply be known as people.
Thank you, Tzanetis.